welcome back to my channel. I'm Dr. Knapp, and today we're discussing borderline personality disorder, or BPD, a complex mental health condition that affects emotions, relationships, and self-image. BPD is often misunderstood, and individuals living with it may face stigma and difficulties in getting the right diagnosis and treatment. However, with the right support and management strategies, people with BPD can lead fulfilling and stable lives. In this video, we'll break down what borderline personality disorder is, explore its diagnostic criteria, and discuss the available treatment options. If you or someone you love has been struggling with intense emotions, unstable relationships, or a deep fear of abandonment, this information could be vital in understanding the condition and finding ways to manage it. Borderline personality disorder is a mental health condition characterized by intense emotional instability, impulsive behaviors, difficulty in relationships, and an unstable sense of self. People with BPD often experience extreme mood swings, struggle with feelings of emptiness, and may have difficulty regulating their emotions. These intense emotions can lead to impulsive decisions, self-destructive behaviors, and frequent conflicts in personal relationships. The term borderline originated in early psychiatry, where the disorder was thought to be on the borderline between neurosis and psychosis. However, modern research shows that BPD is primarily a disorder of emotional dysregulation, often linked to early trauma, genetic factors, and differences in brain function. One of the most challenging aspects of BPD is that emotions can feel overwhelming and uncontrollable. Someone with BPD might go from feeling intensely happy to deeply sad or angry within minutes or hours. These emotional shifts can be triggered by seemingly small events, making it difficult for others to understand their reactions. Diagnosing BPD involves evaluating specific patterns of behavior and emotional responses. According to the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, BPD is diagnosed when a person exhibits at least 5 of the following 9 criteria. A deep fear of abandonment is one of the key features of BPD. Individuals with BPD may go to extreme lengths to avoid real or imagined rejection or separation. This fear can lead to intense clinginess, panic, or even self-destructive behaviors in an attempt to keep people close. They may misinterpret neutral actions as signs of rejection, leading to emotional outbursts or withdrawal. Unstable and intense relationships are another hallmark of BPD. People with the disorder may idealize someone one moment and suddenly devalue them the next. This pattern, known as splitting, causes difficulty in maintaining stable and healthy relationships. Friends, family, and romantic partners may feel confused or exhausted by the rapid shifts in emotions and attitudes. An unstable self-image or sense of self can also be present. People with BPD often struggle with identity disturbances, experiencing sudden shifts in how they view themselves. They may feel like they don't know who they are, leading to changes in goals, values, careers, or even sexual orientation. This instability can make it difficult for them to maintain long-term personal or professional commitments. Impulsive behaviors in at least 2 harmful areas are common in BPD. This includes reckless spending, substance abuse, binge eating, unsafe sex, or reckless driving. These behaviors often occur in response to emotional distress and can have significant consequences for a person's life. Recurrent self-harm or suicidal behaviors are serious concerns for BPD. Individuals may engage in cutting, burning, or other forms of self-injury as a way to cope with emotional pain. Suicidal thoughts and attempts are also more common in people with BPD, making early diagnosis and treatment crucial. Chronic feelings of emptiness can make life feel meaningless or hollow for people with BPD. They may try to fill this void with relationships, substances, or risky behaviors, but these often fail to bring lasting relief. Inappropriate or intense anger is another symptom. Individuals with BPD may experience sudden and explosive anger over minor frustrations. They may struggle to control their temper, leading to verbal outbursts, physical aggression, or long-lasting resentment. Paranoia or disassociation under stress can also be seen in BPD. Some individuals experience moments of paranoia, feeling as if others are out to harm them. In extreme cases, they may disassociate, feeling detached from reality as if they are observing themselves from the outside. BPD can be mistaken for other mental conditions such as bipolar disorder, post-traumatic stress disorder or PTSD, or depression. A thorough evaluation by a doctor or mental health professional is necessary to differentiate between these conditions and ensure the right diagnosis and treatment. The exact cause of BPD is not fully understood, but a combination of genetic, environmental, and neurological factors plays a role. Research suggests that people with a family history of BPD or other personality disorders may have a higher risk of developing the condition. Early childhood trauma, neglect, or abuse is also a significant risk factor. Many individuals with BPD have experienced physical, emotional, or sexual abuse, or have grown up in unstable or invalidating environments where their emotions were dismissed or criticized. These experiences can contribute to difficulties in regulating emotions and forming secure relationships. Brain function differences have been observed in individuals with BPD, particularly in areas that control emotions and impulse regulation. The amygdala, which processes emotions, tends to be hyperactive, while the prefrontal cortex, responsible for impulse control, may be underactive. These neurological differences help explain the intense emotional responses and difficulty in managing impulses seen in BPD. While BPD can be challenging, it is a treatable condition. With proper management, individuals can learn to regulate their emotions, build healthier relationships, and develop a stronger sense of self. Psychotherapy is the primary treatment for BPD. Dialectical behavioral therapy, or DBT, is the most well-established therapy for BPD. It focuses on 4 key areas: mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness. DBT teaches individuals how to manage intense emotions, cope with distressing situations, and build healthier relationships. Many people with BPD experience significant improvements through DBT. Cognitive behavioral therapy, or CBT, can also be beneficial. CBT helps individuals identify and change negative thought patterns that contribute to emotional instability and impulsive behaviors. Schema-focused therapy is another option that helps people address deep-rooted patterns developed in childhood and replace them with healthier ways of thinking and behaving. Medication is not a primary treatment for BPD, but it may be used to manage co-occurring symptoms such as depression, anxiety, or mood instability. Antidepressants, mood stabilizers, and antipsychotic medications may be prescribed depending on an individual's specific needs. However, medication alone is not enough to manage BPD and should be combined with therapy. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, developing healthy coping strategies is an essential part of managing BPD. Mindfulness techniques such as deep breathing and meditation can help individuals become more aware of their emotions without reacting impulsively. Journaling, exercise, and creative outlets like painting or music can also provide relief from intense emotions. Building and maintaining stable relationships requires effort and patience. Learning to communicate effectively, set boundaries, and recognize emotional triggers can help reduce conflict and improve relationships with family, friends, and partners. Support groups and peer networks can be invaluable for individuals with BPD. Connecting with others who have similar experiences can provide encouragement and reduce feelings of isolation. Family members and loved ones can also benefit from education about BPD to better understand and support those affected by the condition. Long-term recovery from BPD is possible, but it takes time and effort. With consistent therapy, strong support systems, and the right coping strategies, individuals with BPD can develop emotional stability and lead meaningful lives. Borderline personality disorder is a complex but treatable condition. It affects emotional regulation, self-image, and relationships, often leading to intense mood swings, impulsive behaviors, and a deep fear of abandonment. Understanding the diagnostic criteria is essential for recognizing the condition, and early intervention can make a significant difference. With the right treatment, including therapy, medication, and lifestyle changes, individuals with BPD can gain better control of their emotions and build healthier relationships. If you or someone you know is struggling, seek help from your doctor or a mental health professional. There is hope, and with the right support, recovery is possible. Thank you for watching. As always, take care of yourself and make the most of your day.